In honor of the grand opening of the new Mary Bird Perkins Cancer Center at TGMC, the staff of TGMC would like to highlight some of the physicians who cater to our community. Their services, their support are what make Mary Bird Perkins Cancer Center at TGMC the world-class cancer center it is.
All right, welcome to the segment tonight, and we have Dr. Harry McGaugh. He's been on quite a bit. He's a medical oncologist at Mary Bird Perkins Cancer Center at TGMC. Say that fast 3 times, of course, and we'll get it out. Doc, good to have you back.
Thank you.
And let's first of all talk about the physicians at Mary Bird Perkins Cancer Center at Terrebonne General Medical Center. I guess real basically, how many are there to start off?
There are 4 of us. There's myself, Harry McGaugh. There's Dr. Raul Doria, who's an oncologist like me, Dr. Bob Gamble, who's an oncologist like myself, and Dr. Jeff Long, who's a radiation oncologist.
Okay. Can you differentiate what each 4 of you do? Do you do different things? What do you specialize in?
Well, the medical oncologist, which is what I am and Dr. Doria and Gamble are different than the radiation oncologist. Our job really is, we're probably best considered as the chief of the team that takes care of patients with cancer. We direct the therapy, but as far as the therapeutic arm that we direct, it's the chemotherapy. We give chemicals either by mouth or by vein. Of course, nowadays I should probably explain that a little better, since there are so many new drugs out there which are not actually chemotherapy anymore. They're monoclonal antibodies and don't have as many side effects as the chemotherapeutic drugs had and most patients would associate with in the past. And Dr. Jeff Long is a radiation therapist, means he directs the therapy, which involves a very large machine like an X-ray machine that actually shoots a beam of electrons and other particles at an affected area of the body where the cancer is located.
Okay. Every time I hear the word oncology, all these years I'm saying, what does that really mean? So what does it really mean, oncology?
Well, oncology just means that your doctor is a specialist in taking care of patients with cancer. We also take care of patients with blood disease. We're not limited to just cancer patients, but primarily it's the care and direction of the treatment directed at a cancer, a tumor.
So we could even differentiate a little further, because there's medical oncology, surgical oncology, and radiation oncology. What's the difference between all 3?
Right. Well, the surgeon or the surgical oncology is basically a surgeon, and he comes into play in the care of a patient, oftentimes in doing a biopsy. That is, a patient may have a lump that he picked up either physically or on a scan, and we need a part of that tissue to make a diagnosis, and the surgeon will often take a small part of that tissue, either with a needle or using a scalpel and doing surgery, to obtain a biopsy where it can be referred to the pathologist, where he can interpret and tell us what kind of cancer it is so we can know what kind of therapy to use. There are also many cancers that are curable only with surgery, and the surgeon is involved obviously then when he attempts to remove the entire tumor. And the radiation therapist, as we already talked about, will direct the treatment using that big new machine we have at Mary Bird Perkins to attempt to shrink up tumors and in fact cure some cancers.
How does the lead oncologist with the different specialties and the backgrounds, sort of like yourself, how are you able to put the team together and sort of guide the team along?
Well, the way it usually happens is a patient is referred to us, often either with a diagnosis of cancer, it's already been biopsied, or they have an abnormality on their scan, on physical examination, and doctors want us to take charge. We'll look at the results. We'll often discuss the case with the pathologist, who's a doctor who interprets this biopsy slide, and with the surgeon, and with the radiation therapist. In fact, we have conferences frequently during a month's period of time, and we sit down as a group and we'll discuss patients and all the complexities of that case and attempt to come up with the best plan of therapy.
How do y'all all participate in outside activities that would affect the cancer center? I know saw Dr. Doria playing golf at the recent golf tournament put on by the cancer center. So, for example, what would you do on the outside?
Well, actually, I'm really not involved in any organized activities this time. I will attend Relay for Life and Love Lights a Tree. Dr. Doria has Nosotros, which is a support breast cancer, and I think he also deals with other cancers, support group at night, which meets monthly. I personally am involved in many of my patients. I am just involved in their history in general. I particularly like to talk to my older patients about what life was like in the olden days.
I've heard that about you. Sort of, you get into your patients as far as what makes them tick. Does that help you learn about them quite a bit too?
I think that, and I do it not to put the patients at ease, although I think it does. I do it because I really am interested in that. Right. And I think they appreciate that. And I think you become friends with your patients, and you develop a trust, which they really have to have in their oncologist, since we're dealing with life and death situations.
And I guess it does put them at ease, though. I guess if you're going to look forward to getting treatment, you just as soon like your doctor, right?
Well, you're right. And actually, some patients do look forward to coming to the office, which is hard to believe.
Yeah, well, that's a good thing. I mean, it shows that you care. We're going to take a break right now. When we come back, we'll have more with Dr. Harry McGaw. Don't go away.
Early detection is the best protection. That's why thousands of women go to the experts. Women's Imaging and Breast Center at TGMC. It all begins here.
Drive the all-new 2011 Chevy Camaro at Tratt Cadillac Chevrolet. Unbelievable acceleration and comfortable sport seats make the Camaro the most exciting sports car on the road today. You'll love the Camaro's retro-inspired body and elegant interior. Enjoy remote keyless entry, power windows and locks, Bluetooth, OnStar, up to 28 highway miles per gallon, and a 100,000-mile 5-year powertrain warranty. The new Chevy Camaro. Available now at Tratt Cadillac Chevrolet in Houma.
Early detection is the best protection. That's why thousands of women go to the experts. Women's Imaging and Breast Center at TGMC. It all begins here.
My PhD is in chemistry, so I've spent a lot of time doing research in the lab. I work for Albemarle Corporation. My name is Arcelio Malcolm, and I was treated for prostate cancer at Mary Bird Perkins. I went to Houston for a second opinion, and they recommended the same treatment plan, so I chose to be near my family and have the treatment done here. When you research the technology and the doctors, you see that Mary Bird Perkins is a perfect choice.
Mary Bird Perkins Cancer Center at TGMC.
All right, welcome back. Our guest tonight, Dr. Harry McGaw. He is a medical oncologist at the Mary Bird Perkins Cancer Center at TGMC. I want to know a little bit more about the cancer committee that y'all put together. It seems like a big thing, big committee, but really it's involved in a lot of things, isn't it?
It is a big committee. There's a lot of individuals that attend these meetings. They include social workers, administrative personnel, physicians, including the oncologists, the pharmacists, the radiation oncologists, surgeons. And what the Cancer Committee does is it tries to take overall responsibility for what's happening in the cancer program at Terrebonne General and plan for the future, which is really important. Look what they did with the new building and the association with Mary Bird Perkins out of Baton Rouge. Yeah. So it just lays the foundation for new developments.
Right. We talked about this earlier, the doctor-patient relationship, and how do you think it affects the patient. You touched on that, but it's got to help them with their confidence, doesn't it?
Well, as I said, the patient has to have confidence in his or her physician, or we're not going to get anywhere. And I think we do a first-rate job here at Terrebonne General, and I think one of the strong points of what we do here is there's a group of us, and we can discuss cases with one another on a minute-by-minute basis if we need help, and we can always learn from one another. So confidence in us is very important, and we encourage one another to talk with the patients and hear about their home problems, and patients have lots of problems. Some patients have money problems. Some patients have transportation problems. Some patients have problems with their insurance, problems obtaining their medications. We have a strong social services department and a dietary department and a wound care department to support them in every which way.
Sort of like being a head coach. You got to, although you're a doctor, you're the head coach, and you sort of put them where they need to be put, right?
A winning head coach.
There you go. That's even better. All right, the support groups that physicians are involved in, or that in general help the patients, what are they?
Well, I think the most prominent one, I thought they were going to put something on television, is Dr. Doria's group, in which patients, and we have the times it meets there, in which patients with all cancers can get together and discuss their situation. And it's amazing, you often think you're alone with the problem, whether it be cancer or anything else, and you find when you discuss it with other people that other people have the same problems and we're all coping with it in the same way. And it just helps you get through it.
Right.
And it helps you to know that other people care about your problem.
And this one's nosotros, right?
Nosotros.
Yeah, nosotros. That's what Raul would say. You got to roll your T's off your tongue or whatever. So anyway, so that's a good thing. Now, the unique bond that each doctor develops with their patients, and even sharing some of the same hobbies. Do you have hobbies that you share with some of your patients?
I have more hobbies than we have time to talk about, but okay. I've learned a great deal from my patients. I've learned a great deal and continue to learn on a daily basis. And one thing I've learned, which is not related to the hobbies, is a patient with cancer's attitude towards life, which is that every day is important. And I try to do that every day. I'm not always successful. I wake up in the morning and see myself in the mirror and say, let's make the best of today. But as far as hobbies go, I have several hobbies. I'm interested in blacksmithing, and I got interested in that in talking to some of my older patients. There are not any surviving blacksmiths who are my patients, but many of them will remember their grandfathers or their fathers, and a lot of them will remember turning the hand crank for the blower. In fact, a man told me about that
yesterday. My daddy was telling me that the other day. My grandfather was a blacksmith. He used to sit there and turn the hand.
And I've been to patients' houses to look at some of their old blacksmith tools. I raise bees, which I became interested in talking to patients, and I've been to patients' homes, and I've learned a lot from them in that. Sugar cane, I have a lot of old grinding equipment, and I'm still picking up pieces from patients, and I just love to hear the old stories about eating syrup and taquit, I think they called it, which is a thick form of molasses.
You seem like you have a lot of mechanic and a lot of engineer in you somewhere.
I try.
Yeah, you'd have probably been a good one for sure. We know you're a great cancer doctor, but tell us, what about the new facility? I know everybody else I've talked to is pretty impressed with it.
Well, how can you not be impressed? And it really is a beautiful building. And if anybody hasn't seen it and they want to see it, we'd be glad to give them a tour. There's lots of space in there. It's wide open. The chemo area has an exposed guarding. It's all windows on 2 of the 4 sides. We think it's going to help with the flow of patients, make them know how much we appreciate them and how much we enjoy taking care of them.
For those watching tonight, Doc, how can people learn more about the Cancer Center at Terrebonne General Medical Center, Mary Bird Perkins?
They can call 985-873-4616 or go online at www.marybird.com.tgmc.
All right, next time I break a piece of steel or something, I'm going to bring it to you and you can fix it in your blacksmith shop.
Sounds good.
All right, we appreciate you being by. Once again, Dr. Harry McGaugh, he's been on quite a few times, and we appreciate him being here. We'll take a break. We'll be back with more right here on Bayou Time. Don't go away.